So the topic is human enhancements through technologies, and as an introduction, I wanted to say that we live surrounded by technological artifacts, whether low-tech or high-tech. They get closer and closer to our body. So now, from time to time, it leads not only to technology questions or use and deployment questions, it leads to existential questions like we live in fear or fantasies about technological enhancement of humans, human augmentation, cyborgs, and etc. So this panel is made of a current example, use case, that actually provide a concrete ground of what the technology can do for humans. So I have the pleasure in this panel to be accompanied by Hans-Jørgen Wiberg, right to my right. He's the founder of Be My Eyes. He spent most of his professional career in organization providing assistance to the visually impaired. And he founded Be My Eyes, a micro-volunteering mobile app which allows people with visual impairment to get in contact with sighted volunteers via a video live call. He's going to explain that in a while. Then next to him is Neha Chaudhry. She's a Britain's entrepreneur. She is product designer, engineer, and with a master in marketing, and the founder of Walk to Bead that develops a walking stick for the Parkinsons disease patients. Then Genta Kondo, directly from Japan, has worked on a Bionic Arm as an engineer for a decade and switching different affiliations like, you know, grad school, then a private company, startup, and now working for a foundation, Mission Arm, right, yes. Japan. And next to him, last but not least, Jowan Österlund, self-described body hacker. Jowan founded Biohax International in 2013 and have 15 years experience in, you know, piercing and body modification. And he's going to tell us about human enhancements through technologies, the topic of our main panel discussion. So to start, you know, I thought the simple question is to ask each of the panel members of how do they relate to human enhancement technologies. So Hans, how do you relate to human enhancement technologies?
Well, as a almost blind person, I know that it's super important to have this technology, and what we're doing in Be My Eyes is we are allowing sighted people to, in a super technology way, help blind people, but it's a super simple app that we are doing. So basically, any blind person, also non-technically blind person can use this app. So it's an easy way to approach this help and use the technology.
So maybe we can add the image of the app on the screen. I think you have that, so we can see. Right. Okay. We put up an image on the screen. Neha, how do you? Why did you start doing this project that is help to technological help to human?
Right. So since I'm a product designer, I aim to solve real-life problems with products. I see them as objects which can interact with people, and I believe in a human approach, but hiding the complexity and the technology behind it. So trying to solve the real problems. I like things which are subtle and discreet. I've always been interested in creating something that could help people. So this is a first product from Walk to Bead, which is a smart stick designed for Parkinsons sufferers. It looks like an ordinary stick from the outside, but it's got technology installed in its handle. So for people who don't know what Parkinson's really is, so the problem that we're trying to focus is the Parkinsons sufferers tend to freeze while they're walking, and freezing almost feels like your feet getting glued to the ground, and you're like stooping, and it can eventually cause falls. it was very interesting to know that a rhythm can help the patient start walking again. So people who listen to music gives them a buzz or like a signal which overpasses their freezing episode and they can step forward. The stick is actually sensing your walking patterns, and what it does is when a person actually freezes, they tend to festinate, and it brings a buzz in the handle, which is a continuous rhythm, which then gives them a cue to start moving again. I mean, it's a simple concept, but it has tended to help people. The thing, so it's the same idea, like my point is to make it discreet. So what I just did, none of you could see what's happened, but that's the whole point, because the person who's already suffering from an illness, we shouldn't make their condition obvious. So that's what we're trying to aim with this.
Okay, thank you. So let's make technologies discreet, so the adoption rate can eventually be greater, right? So Genta.
Yep.
So talk to us about human enhancements through technologies with your bionic arm.
Okay, I guess it'll be easier to show the demo first. So this is a bionic arm. It's an artificial hand for people who lost them to recover the function again. And the point is it's all 3D printed, so it's pretty cheap. You can make it by yourself with $400, so to say. So, and here's a sensor I have. So yeah, by pressing this sensor, you can control the fingers. And for people who actually lost them, they still have muscle remaining. So they put this sensor around their residual arm like this. And whenever they made a contraction, the hand gonna move. So I've been working as an engineer in this field. Just to mention my attitude towards this field, I first started engineering career just for pure interest for science. Like I just wanted to know more about human brain and body and how it works. But as I got to know with actual amputee during my experiment in college days, I started to get more interested in like personal story, like the emotion like each person have inside them. So then I shifted to this project to make it first affordable, to make it cheaper, and also to decorate it in a fashion way, because one subject told me that they don't want the skin color version, but they rather want like, scientific decorated one, just like, sneakers or watches you wear for your personal wearable items. So. Yeah.
Okay, so any advantages in doing it through a sort of a not-for-profit organization compared to, big corporation or even startup? Any difference in there?
So as she introduced in the beginning, I started as a graduate student, and then I started working with a big company called Sony as a robotic engineer. Then I started my own company, startup, and now I finally doing as a non-profit organization. So it's not alternative choice. Like you can do both or multiple positions at the same time, I think. So each has advantage. And the reason I'm doing as a nonprofit now, because I can be like pretty neutral. I don't have to care about the growth of the organization, or like I don't have to be too focused on like making a profit. So I just purely can focus on what I want to do to bear lots of personal story with technology. So.
Thank you. So, Jowan, with technology increasingly becoming, closer and closer to our body, so how do you relate to human enhancements through technologies?
I find it perfectly normal to use technology to enhance our very, very limited selves. For example, I don't know how to speak digital until I implant a device to do my speaking for me. So by developing these implants, I let my implants do all of the communications by connected surroundings.
So maybe we can put up the picture of the product,
the slides are
implants,
lagging a bit.
chip that you're developing. So you're starting with a piercing, and then you felt it was like something like self-empowerment, or?
I got my earlobe pierced when I was 7, and had just the most awesome feeling of actually changing my body and, well, deciding what happens with it. It didn't do much. It was a little silver stud, which I dropped like a week later. But having that first Johnny mnemonic moment when I actually programmed myself and had my arm dictate how my phone acted was a bit of a wow moment. So.
Okay, so you live that more than happily with a wow effect.
Yeah, I mean, a speaking machine is awesome. I can get, well, not everything, but if it speaks NFC, I can basically technically get it to do anything.
Right, so we would think that potentially human enhancement through technologies, since it's like causing fears and fantasies and etc., that the major problem is the sort of people resistance. But in truth, Hans, what is the main challenge you've got in deploying this technology?
Well, in our case, I think the main challenge is when you are trying to reach blind people in the whole world. They don't read the normal newspapers and so on. So to reach the blind people and make them aware of your product so they at least can try it out is quite a challenge. But we've been using Facebook. You see, we started out in 2013, and basically no blind person was on Facebook because Facebook was not accessible for blind people. So we had to go through friends and other radio and television and so on, and that can be a difficult way to go. So reaching the blind people has been quite a challenge, and also it is still to this day.
Okay, so what we can say is like we need to provide access to those technologies, not just like people willing it and looking for it and etc. We have to facilitate the access of those technologies to the people in need, actually. Neha, so what's your main challenge actually in developing those technologies?
Right. So for me, there were three things. Firstly, one size cannot fit all. So in this case, not everyone walks in a similar manner. So the problem that we're trying to tackle is for people who are desperate for a solution, and they want, so each one of them wants a solution for their particular problem, which is really difficult to solve. I wish I could with a magic wand, but it's just not possible. So secondly, making a product reliable on a day-to-day use, which means as we're dealing with like a chronic illness, which degenerates over time, so the condition is going to get worse, people's walking is going to get even worse, so like the stick has to deal with it. So what we've learned is that all we can do is make it adaptable for as many people as we can and make it customizable. And lastly, because it's classed as a medical device, even though it's a low-risk thing, so as a startup, I think dealing with all the bureaucracy around getting the certification done and all of that has been challenging. I can see people smiling here because they've been through the same thing. Yeah, because this was actually my final year undergraduate project initially where the concept began, where that's when I witnessed my late grandfather who suffered from Parkinsons. So yeah, having a concept to making it to a product and then making it commercial is a steep learning curve, but the rewards that I've been getting are priceless. So, yeah.
Okay. So Jowan, you wanted to interfere into like, the bureaucracies or regulations?
No, I'll stay out of the bureaucracy part. Just no interjections. You only got 26 minutes left.
No, we've got 26 minutes. We've plenty of time to discuss that. So, Genta, what's your sort of main challenge now?
It's quite similar to what Neha has mentioned. Like, 3D printer has changed a lot. It kind of democratized hardware project, but it's like still difficult to mass produce because yeah, like lots of Kickstarter project is failing in the process, the manufacturing. So mass production in itself is difficult, but also in this kind of field, like the population is so limited, so which is also hard to make it profitable. And even in this small population, each person has different, of course, desire. I mean, request, and also different, size and shape of the hand. So like for a kid, I want to make like small hand, but some kids say I want like black one, blue one. So to cover all those, needs, the conventional, setting of producing has to be totally changed, and I still haven't come up with concrete solution yet.
So, in a nutshell, what we say is like we have to provide access to the people of the knowledge of the existence of such situation, and as well bring those technologies closer to the user so that they could adapt to them, more fine-tuned for them, and the use of 3D printer, of the internet access, which needs to be where visually impaired are, and is something that is really important. So, Jowan, since you definitely bring technologies as close to the people as you can, since you embed them in them, so have you faced some challenges of resistance about that?
Yeah, airport security doesn't let me take
Airport
the
security.
implant kits on carry-on. No, I would say the wide difference in regulation and legislation in different countries, different counties. In the States, it can be totally different from Chicago and then going outside of the county. But most commonly it's the sci-fi fear of technological implants containing polonium or KGB backdoors, explosives, and GPSs. If I could make a GPS that small, passive, I'd be on the moon building my lunar base. No. So it's not resistance per se, more like speed bumps. It's all about educating people about the technology and how to utilize it before it gets used the other way around. So if everyone knew what the internet could do and would do, they'd probably act differently from the get-go. And I mean, people still don't know.
Right. So when we were preparing this panel, we mentioned cultural differences was finally an important factor in terms of how do we adopt technology. So Genta, you wanted to mention something about like the Japanese perspective eventually.
Okay, so I'm from Japan, I'm Japanese, and I hope you guys know lots of Japanese comic or animation. So from Japanese standpoint, I think like Eastern culture is more good in like kind of animating or visualizing it. But we're pretty conservative to actually take it into action. So we have lots of speculative fictions that discuss about like future of brain-machine interface, like Ghost in the Shell kind of thing. Our medical department is pretty strict to actually test it. Like even tattoo is not kind of allowed. Like if you have a tattoo, you cannot get into the public baths in Japan. So we still have like old mindset. So like having speculation in Japan, but like collaborating with European culture or like other part of the world and have the test field there and like interacting will be a great way to like move forward. Not only the practical side, but also like speculation side. So.
Right. Most of the speculative sides is very often gloomy and like, leading to the end of humanity. Any brighter futures? Eventually, you could sort
of course,
draw.
it's at both sides. But it's worth, thinking about it and have a discussion, I think.
Can I slide on, Neha? Some, sort of cultural differences that you can feel that is impeding eventually access of technology to people?
So, yeah, like Genta said, I mean, I could relate to it, but it's even worse, I would say, because originally I come from Pakistan. I've been in the UK for the last 6-7 years, but the stuff that I've been doing in the UK, we can pilot test it and do stuff, which is good. People are used to it, they know about it, and they are very, in fact, helping in co-designing and trialing the product as well. But when I think of taking this back home, there is a huge gap because people, firstly, there isn't enough awareness about these degenerative conditions. And then secondly, I think they are slightly resistant to new technologies. So I think it's going to take a while. Like, I think it's a good idea of how Genta just said that by collaborating with European platforms and then taking that information back and sort of showing them would actually help. So we need to sort of come together as a world to improve others as well.
Okay. And Hans, you've seen cultural differences in the way people use your app, for instance.
Yes, we have. It's kind of interesting because just when a blind person wants help, they just have to press the button. But then you have to start a conversation. And I have noticed that in some cultures, it is still, even if you know that the person wants to help you, you kind of need to start a conversation before you can ask for help. And this can also trigger the other person to think, what is this person up to? Does he want help or not? And this is kind of also a cultural thing that we cannot do much about it. But it's interesting that a small thing like starting a conversation is rather different from culture to culture, and it can cause some misunderstandings and so on. Yeah.
So again, while preparing that panel, we said, okay, so we have to provide access, we have to have, educating and talking to people about what technologies can do actually for good. Huh? And instead of thinking of that gloomy future that people are promising us, but the way people adopt enhancements through technologies for the human and, more or less close to your body will probably depend on cultural differences, but is also somewhat, there's impediments, and impediments is like, we have technology advancing rapidly and culturally, socially, economically, and institutionally. We're not enough aware, and we're not making that change at the same rapid space. So any sort of additional idea of how we can help in that? Yes, go.
No, it's just Be My Eyes was invited to Singularity University for 10 weeks, and this was completely awesome. And one of the things that we learned is that you have to develop now something that is not possible now, but when you are done developing it, it will be possible to do it. And just this kind of thinking, and it's it can be, if you are waiting for some cultural change, that might take quite a while. But on the technological side, it's super important that you kind of jump into it, because when we started developing Be My Eyes, hardly any blind people were using smartphones. So it was kind of an impossible thing, but we knew that they would catch up. And Android was totally inaccessible to blind people. It was only iPhones. 90% of the blind people in this world, they live in low-income settings like India and Africa and so on. So we couldn't even reach them because they would not be able to afford an iPhone. But now Android has come up to speed, and Android phones are just as accessible as for blind people as iPhones, and they are way more accessible to buy because they are cheaper. So now we can join that bigger group, and we can see that 90% of our users in India are on the Android platform, and we couldn't reach them before. So it's
it's a question of being patient.
If we had waited, then we would to start in 2 years from now on. But now we have developed it, and we are ready when they are ready, so to speak. So.
Okay, so that leads to, we can go and switch to questions and answers, because we kind of would like to discuss with you guys. And so that leads very naturally to that question that says, where do you see human enhancements concerning joints and extremities in 15 to 20 years in terms of function and aesthetics? Because we can prepare now, and even if people are not ready, having a vision of that, we can advance the technologies, and then, adoption will go its way slowly. So anybody has a will to answer the question of extremities and joints? Genta, maybe?
Pretty sure we can 3D print from stem cells in 15 to 20 years. If you want a biological, well, if you don't want to be bionic and have a much, much better arm, you can go al natural and do it biological.
Okay, so stem cells, 3D printing.
Yeah, easily.
All right.
I would trade.
Genta, do you agree?
Healthy bag of flesh for a cool bionic one.
Yeah, I agree with that. Like 3D printed is at the moment it's only mechanical side, but in 10 years time frame, I think it's gonna integrate with biotechnology too, so that we can actually print out cells and neurons maybe. But another opinion from my side is that I guess people can imagine more choices. Imagine when you ski or skate or whatever sports you or musical instruments you play. To do specific hobby, you need some device to enhance your ability. So, Bionic Arm, since they have a space here. A good point is that they can change it every day. So don't stick to the natural hand itself. You can imagine all sorts of functions that natural humans even haven't reached yet. So I think we will see a lot as the time goes. Yeah.
Okay. So anybody else? No? So well, let's go to another question. So do you think bioenhancements will become superior to our natural parts?
They already are.
Of course, they already are.
Yeah, the fastest person alive doesn't have any legs.
Yeah.
They definitely already are, even not necessarily bioenhancement, my computer is better at calculating than me, my cell phone is better at keeping memory of the telephone numbers than me.
I had
they're already better than me. Yeah?
I have this eye disease where I'm eventually going blind, and so I'm looking very much into what can be done about that. And one of the things that they can do is implant a chip in the eye and connect it to a camera. And I don't see why I shouldn't get night vision, so I can be
like that.
Yeah, and should be able to watch YouTube without anybody knowing about it, and so on. So in that sense, it should be possible to do things that the normal body can't do, and also these. What do you call these exoskeletons that you can put on? Why shouldn't you be the strongest guy in town if you have one of those? So it's I think it raises some.
Everything, all the exoskeletons are so big and lumpy. You should just put it on the inside, and it's always there. I mean, I would get a heads-up display. You could have a bionic eye. Tell everything. Have a spectrometer, so you could measure nutrients in anything you eat, zoom, infrared scope.
You can think of.
All right. Yeah. So we discussed actually the sort of brain and body kind of correspondence, Jowan, when we discussed together, because I said, sometimes, my body gets old, but because my brain is old too. So what will happen if I'm like 82 years old, can sprint like an Olympic champion, but my brain doesn't have a clue where I am, and etc. So that leads to the question. No, I thought, it's good. Like my brain gets slower and slower, so my body is slower. So that's kind of in tune, an harmony between brain. And then we got some questions about use case supporting neurological or psychological deficits or brain enhancement. So I'm trying to combine two questions in one because we have 9 minutes left. So anything about the neurological, the sort of brain enhancement that would go with the body enhancement?
Yeah, I think a neural cortex enhancement or brain interface or whatever could relieve the brain of actually having to do all that autonomous thinking. So the neuron degradation would slow down a bit. But ultimately, I'm pretty sure we can get some type of steroid to just stop the neurons from degrading.
Okay.
I mean, there's no money being put into it, but longevity, it's a fairly new field, and as soon as there's $1 trillion per year put into longevity, it's going to be booming. You can 3D print a new body. I mean,
brain.
Well, just keep the one you have.
Yeah, we have to. Yeah. Any further comments?
I think there are stuff which has been happening to support the people who are suffering from neurological conditions, because usually these, let's say Parkinson's, Alzheimer's, or dementia, they do not have a cure, like they're not being able to stop it, but you can only prolong the symptoms by the medication. So I think firstly, like, we can even focus to solve their immediate struggles and problems, but there are also stuff being done for, like, for example, for Parkinson's, they're doing this trial where they implant a chip, but it's with a medicine that it is actually, because Parkinson's is when a chemical called dopamine lacks in your brain, so it is actually putting that chemical into your brain. So in a way, it's an enhancement of the brain that you're getting that nutrient back in to perform the symptoms, I think, yeah.
All right, and to say for the people having autism, so first of all, there's a debate about, is autism really a disease, or is it just another kind of intelligence, and that is not necessarily socially adapted, and that maybe we should, the same way we do for visually impaired, some specific effort so that they can integrate and be included in society. Maybe we should do the same type of effort for autistic people, because like we could, for example, in these rooms, they might feel very uncomfortable, so we could have like maybe a separate room, a bit less crowded, or where there are some dividing walls. So there's a question of us being inclusive of autistic people as just different people, not necessarily, handicapped or having a disease. And the second, there are some robotics, it's to answer the question on autism, there are some robotics devices that serve as intermediate between the autistic person and the social environment, and they sort of train by getting accustomed to discuss with a robot, and then, they can go with less fears or less social, problem into the next phase of us being more complex than a robot. So that's to answer the one on neurological and psychological deficits, more specifically on autism. And maybe we'll take one or two last questions to conclude. So so I think we said we do think technology in human enhancement is ahead of society being ready for it. And so what do you think we can do so that we narrow the gap?
Make more. Getting people acquainted and letting them hear it and see it enough times, that takes away the drama from it. I mean, 4 years ago, when I told people I had implants, like opening my phone, deactivating alarm, booting computers, and I can ride trains with it. People like,
So
you know you're Satan, right? Or like, oh, Orwellian dystopia, you're gonna ruin the world, everyone's gonna be controlled, KGB, polonium, explosives, and everything.
Right, so remove the drama by getting people near those technologies and, you know, talking about it.
Yeah,
That's
I mean, the people
when
saying
closing the
over
gap.
my dead body before are more like, oh, so it could replace my keys in my wallet? That's awesome. Basically just showing them, this is not gonna kill you, this is actually awesome. Can replace any plastic card, any paper ticket.
Right.
And
so more opportunities to demonstrate, show, removes the fear and the fantasies. Genta?
Yeah, well, especially I want to insist that we need more developers. Not because the title of the Congress is WeAreDevelopers, but I do think making more developers is important. Let me show one newspaper. This just came out when I open sourced this project back in 2015. A week after I disclosed all the data, one editor of a newspaper who himself is an amputee, so he doesn't have his right hand, but what he did was he came to my office and asked me to teach him how to make the hand, how to 3D print, and how to assemble, do the electronics, all the stuff. And this came out. This is a nationwide newspaper. This is most persuasive format, I think, that amputee himself is making the hand. And he can even customize it in his personal ways. So not only for this bionic hand, but it could be like every devices, like to have more developers and like show that he himself or herself can improve her life. They're gonna be the most efficient and persuasive way to have the understanding.
All right, so testimony of users and more developers talking about it and actually doing those kinds of devices.
Yeah.
Neha?
I think talking more is definitely one thing, and it's also the thing that I experienced is because my demographic is the aged population, people who are above 70 or 80 years old. So yeah, we had to make the technology as simple as possible for them to use. But the co-designing process actually really helped me to let them understand about the product, and having their input actually built their interest as well. So they were actually, after trialing the product, they were like, okay, so can it do this? What if our steps are going smaller? Can we see that? Can we show that to our physiotherapist? So engaging with them is one of the things. So maybe arrange like drop-in sessions and like co-design workshops.
Okay, so co-design, co-construction, co-evolution of the products. And you? Hans?
Well, I think this is the stupidest walking stick you can get. It can't do anything. And you have done the right thing by putting the technology, it's heightened in here. Yeah. So, and I think that's super, super important because you don't want to stick out, so to speak. And this is really, really important that we are aware of that. And within Be My Eyes, it is a completely normal iPhone. It's not a clunky handicap device that you're using, and I also think that's super important that we acknowledge that we we want to be looking just like everybody else. So and have that in mind. So it's not enough to just make something that works. It also have to be something that you can live with and you don't are ashamed of and whatever. And there's some big cultural things here as well. So that's super, super important. And don't get too excited about the prototype. You really have to also make it socially accessible and acceptable.
I mean, it doesn't have to be glamorous, but it's got to be functional and simple, basically.
Okay, so technology getting closer. Us, or you, technological people, when developing product, getting close to the user, and spending time opening those technologies, educating people about technologies so that we show the pragmatic solutions, the case, use case that are already there and can together you know, do the co-evolution of that for not a gloomy, you know, sci-fi, horrible future, but maybe for, you know, human enhancements through technologies that actually benefits us and our environment. So that's it. We are, I think, right in time. So thank you very much.